Well, this is wonderful. I want to say hello to everyone and welcome you. I am Amber McCracken. I am the Senior Director of Programs and Community Impact at the PAN Foundation, and we are so happy to have you here today to talk about something that is incredibly important and incredibly timely. So we are so thrilled to be able to bring some information to you as you navigate Medicare open enrollment. If I can go to the next slide, please. I get the distinction of doing some housekeeping before we get started, which I will go through very quickly because we have so much that we will be sharing with you today. And in saying that, I don't want anyone to panic because we are going to go through a lot of information, but you will be getting these slides at the end of this presentation. So please don't worry about having to scribble down a lot of notes. We will be emailing all of you who registered a copy of today's webinar and a recording of that. So we really hope that you are able to use that as reference, but also share that with friends, colleagues, families who may were not able to join us today. We also wanted to let you know that we will be using the chat feature, which I'm hoping that most folks will know where that is. But if you look along the bottom of your screen, you will see a chat feature where you can send in questions. Most of you and many of you, when you registered for this event, sent in questions. And we want to say thank you for sending in those questions because we were able to really orchestrate and organize this presentation around those questions. And so we really hope that we're able to answer a vast majority of those during this presentation. And for those that we don't, please feel free to put those in the chat as we are going along. And we'll also be giving you guys lots of PAN resources, including our Medicare Education Hub, which will also be in the slides as we move forward. So we can go to the next slide. And with that, I'm very excited to welcome our president and CEO of the PAN Foundation, Kevin Hagan, who is going to be giving you all a wonderful welcome and get the distinction of introducing our wonderful panelists today. So, Kevin?
Thank you, Amber, and hello, everybody, and welcome. I'm Kevin Hagan, the president and CEO here at the PAN Foundation. And on behalf of all of us, the entire staff here at PAN, I really want to thank you for joining us today. At PAN, we're really committed to bringing you the information that you can use to gain the greatest access to care throughout your health journey, and also to give healthcare providers the tools that they need to really support patients through their journey. While many of you may be familiar with our financial assistance programs here at PAN, PAN is also working really hard to bring you education topics, particularly those on complex health topics, so that you can digest them in a way that makes it a little more usable for you in terms of information. And that's what we hope to do here today. So in this webinar today, we're talking about Medicare and open enrollment. And I think many of you are aware that there's never been a more important time to learn about the changes, offerings, and the resources that are available. So we're really excited to have you join with us today on this webinar. And we really hope that this will help you understand why Medicare open enrollment is so important this year, and will provide you the information and everything that you may need to make the best decision for your health. We have two outstanding speakers here with us today, and I am honored to introduce both of them. And first is Amy Niles. Amy Niles is an incredibly knowledgeable healthcare executive with a passion for advocating for patients and long-term policy solutions that really help improve access to care. Amy serves as PAN's Chief Mission Officer, where she leads the organization's financial assistance, advocacy, and our education initiatives. So, Amy, we're excited to have you be one of our key speakers for today. And then secondly is Susan Neff. Susan is an Aging Services Supervisor in the Pennsylvania Department of Aging's Education and Outreach Office, where she actually directs PA Medi, which is Pennsylvania State Health Insurance Assistance Program, their SHIP program, and oversees the department's health and wellness and volunteer programs, as well as leads Pennsylvania's Fall Preventions Coalition. So we're excited to have you join us as well today, Susan. So I think you're in for a great webinar today. You have two incredibly knowledgeable speakers to share the important information that we have today around Medicare and the open enrollment period. So without further ado, I'll turn it over to Amy and Susan. But again, thank you all for being here today, and thank you for being part of the PAN family.
Thank you so much, Kevin. And I want to thank the many thousands of you who have registered for this webinar and are sharing some of your time with us this afternoon. Susan, it's always wonderful to present alongside of you. We have a lot to cover in the next hour. Over the next 60 minutes, we're going to go over some basic terms in Medicare. Medicare can be awfully complicated. We'll talk about the programs and various options that can help all of you potentially lower your out-of-pocket costs. Certainly, we're going to spend a lot of time on discussing open enrollment, and it is the time when you turn on your televisions or turn on your radios, you are probably being bombarded with lots of messaging from the media. So we're going to go over that as well. And then as we close out today's webinar, we're going to share with you the details about how Medicare is changing in 2026. And of course, throughout, we're going to be sharing some important free resources for all of you. Next slide. And one more. So there are some key insurance terms that all of you should be familiar with as you go through the open enrollment period. We won't go through all of them today, but I want to highlight a couple. As you prepare for open enrollment and you're considering various plan options, you will want to learn more about what their premium assistance looks like, or what the premiums will be for the plan, as well as your deductible. At the end of this slide, you see formulary. That's the list of drugs the plan covers. And this is really important because that list of drugs can change from one year to the next. The next slide. And as you think about your plan options, particularly as you are comparing Medicare, traditional Medicare, and Medicare Advantage plans, and we'll go over some of the key differences between those plans in just a moment, you're going to want to think about the healthcare providers that you need access to, whether they are in network or out of network. You're going to want to think about also, for example, prior authorization. Some plans may require prior authorization for medications or other services, while other plans may not require prior authorization. So lots to think about when you are considering traditional Medicare and Medicare Advantage plans. Next slide. So Medicare program is awfully complicated, and as you may know, it is divided into various parts. Part A is your hospital insurance, covering your inpatient hospital stays or care in a skilled nursing facility. Part B, as in boy, is your medical insurance, which covers visits to doctors, outpatient care, lab tests. Some of you may not know that Medicare Advantage is also called Part C, and Medicare Advantage is also that all-in-one alternative to traditional or original Medicare. Now, it may include some benefits that traditional Medicare does not cover, but importantly, it very often includes prescription drug benefits, which will be a key focus of our conversation this afternoon. Next slide. Medicare Part D is the part of the Medicare program that covers prescription medications. It can be offered as a standalone prescription drug plan or, as we just discussed, as part of a Medicare Advantage plan. Now, I thought it was interesting to just note there are nearly 69 million people today enrolled in the Medicare program. And about 8 out of 10 of them have Part D coverage, prescription drug coverage. And what we're finding that of those nearly 56 million people with Part D coverage, most of them have Part D coverage through a Medicare Advantage plan. In fact, 6 out of 10 have coverage through a Medicare Advantage plan. The remainder have it through purchasing a separate plan. And we are certainly seeing trends where more and more people, it seems, are getting their coverage through Medicare Advantage. Next slide. Now, we talked a little bit about Medicare and Medicare Advantage. There's no right or wrong in terms of which option you go towards. This is really a personal decision, but there are some key differences between Medicare and Medicare Advantage that are very important. Coverage is certainly different between the two. As we just discussed, for prescription drug coverage with original Medicare, you would have to purchase a separate Part D plan, whereas most Medicare Advantage plans bundle Part D coverage in the overall plan. In terms of providers, this is a big difference between the two, whereas in original Medicare, any provider that accepts Medicare, you can visit, but in Medicare Advantage, there may be a much more limited network of providers. Prior authorization is another key difference between the two. It's usually not required in original Medicare, but is often required in Medicare Advantage. And I mentioned just a little while ago, the extra benefits, vision, dental, and hearing services are the benefits that we all hear a lot about in terms of Medicare Advantage, but not in traditional or original Medicare. Next slide. So I'm going to turn it over to Susan to review some key programs and insurance options that can help lower your costs.
Thank you, Amy. And I'd like to introduce everyone to an important set of resources that are designed to help individuals with limited income and resources manage some of their healthcare costs. These programs work in partnership with Medicare to help eligible individuals pay for some of their out-of-pocket healthcare costs. This can include premiums, deductibles, co-payments, and coinsurance expenses that can add up quickly for those living on a fixed income. There are 4 main types of cost savings programs, each with its own eligibility requirements and benefits. We have Extra Help, Medicare Savings Programs, Medigap, and the State Pharmaceutical Assistance Programs. Over the next few minutes, we'll explore the different types of cost-saving programs, who qualifies, what costs are covered, and how to apply. And understanding these programs are key to saving money and making the most of your Medicare benefits. So let's talk more about Extra Help. The Extra Help program works with any Medicare Part D prescription drug plan to lower the cost of premiums and prescription drug costs. If you have limited income and resources, and these limits typically go up each year, you may qualify for Extra Help, also known as the Low Income Subsidy or LIS. Extra Help is administered by the Social Security Administration, and you can apply online at ssa.gov or call 800-772-1213. Individuals eligible for the Medicare savings programs, which we'll talk about next, automatically get the Part D Low Income Subsidy Extra Help for prescription drug costs. You can apply for Extra Help and Medicare savings programs at the same time. Social Security will send your information to your state to initiate a Medicare savings plan application unless you tell them not to on the Extra Help application. So next, we'll talk about the Medicare Savings Programs, or MSPs. They help cover Medicare premiums and cost sharing for Medicare beneficiaries who have limited income and resources and who do not qualify for full Medicaid. Medicare can be costly for beneficiaries with premiums, deductibles, and co-payments, and some individuals simply cannot afford these costs. MSPs help make Medicare affordable for those who qualify, saving individuals over thousands per year. Income and resource limits for MSPs do change every year. Even though they help with Medicare costs, MSPs are administered by Medicaid, and you must apply through your state's Medicaid agency. The MSP transfers funds from the Medicaid program to the Medicare program. As mentioned on the last slide, individuals who are eligible for an MSP automatically get extra help for prescription drug costs. And another benefit of MSP participation, there is no estate recovery. States are not allowed to ask for repayment of the costs that they covered under the MSP from the estates of deceased MSP beneficiaries. For those with more financial stability, Medigaps may be an option for you. Medicare supplement insurance, also known as Medigaps, is extra insurance you can buy from a private insurance company that works with Original Medicare to help pay for your share of costs and can be used anywhere in the United States that accepts Medicare. There are 10 different types of standard Medigap plans, each named by a letter of the alphabet, and we have plans A through N. Each plan covers different things, but the benefits are the same for plans of the same letter, no matter what insurance company you purchase the plan from. Medigap policies, unfortunately, do not include prescription drug coverage. You can join a Medicare prescription drug plan separately. Medigap policies, unfortunately, don't cover long-term care, vision, or dental, hearing aids, eyeglasses, or private duty nursing. Monthly premiums for Medigaps range from $100 to $300, and premiums can vary based on which policy you buy, where you live, and other factors. The amount can change each year, and you also must keep paying your Part B premium to keep your supplement insurance. Under federal law, you get a one-time 6-month Medigap open enrollment period, and it starts the first month that you have Medicare Part B and you're 65 and older. During this time, you can enroll in any Medigap policy that your state offers and will generally get better prices and more choices among policies. After this initial enrollment period, you may not be able to buy a Medigap policy, or it may cost more, and you may be subject to medical underwriting depending on your state of residence. State Pharmaceutical Assistance Programs, or FPAPs, are state-run programs that provide financial assistance to certain populations to help pay for prescriptions, though coverage varies widely by state, usage, and specificity. Some FPAPs provide wraparound coverage for Medicare Part D, meaning they help cover the cost of prescriptions that Medicare Part D does not pay for. Some programs assist a wider range of individuals, including AIDS drug assistance programs, a type of FPAP that pays for HIV or AIDS-related prescriptions, or the FPAP may target specific populations such as those with prescriptions to better manage their behavioral health. These programs play a crucial role in helping individuals manage their prescription drug costs, particularly for those who may struggle to afford necessary medications but do not qualify for extra help. If you think you may qualify for assistance, check your state's program for eligibility requirements and application procedures. So what exactly is Medicare Annual Open Enrollment? Medicare is different from private insurance. It doesn't offer plans for couples or families, and you don't have to make the same choice as your spouse. Each year, you can choose which way you get your health coverage and switch or change drug coverage. So the Medicare Annual Open Enrollment period is October 15th to December 7th. Open enrollment is the time to think about what benefits will matter to you and compare your options for the next year. It's important to review your Medicare Advantage plan or your prescription drug plan These often change their premiums, the services offered, provider networks, formularies, and pre-authorization requirements. You cannot predict what health challenges you may face in the next year, but you can make sure that you will have access to quality health care. Any changes you make during your coverage during open enrollment will begin on January 1st of 2026. During open enrollment, those who are new to Medicare, just turning 65, can sign up for Medicare, prescription drug coverage, and health plans to complement Medicare. If you're already a current Medicare beneficiary, you can review and join, switch, or drop Medicare Advantage or prescription drug coverage so that it better meets your needs. You can switch from Medicare Advantage to Original Medicare or vice versa. You can switch from Medicare Advantage plan to another. You can switch from one prescription drug plan to another, and you can join a prescription drug plan if you don't have any drug coverage. But please note, a late enrollment penalty may apply, and Amy will further discuss penalties in a little bit. You can also drop Part D coverage altogether, but please note that re-enrolling in a drug plan in a later year will include a late enrollment penalty if you're not maintaining other creditable drug coverage. So now I'll hand it back over to Amy.
Thank you, Susan. So before we continue, we'd love to just stop for a few seconds and take a poll for all of you. The question is, in the last 3 years, how many times have you changed your prescription coverage or plan? The options are every year, one time over that 3-year period, 2 times over that 3-year period, or I've not changed at all during that 3-year period. And we'll just take a couple of minutes, couple of seconds, and then we'll see what everyone is saying. Okay, getting ready to close the poll. About 6 out of 10 of our participants today have not changed their prescription coverage at all or their plan over the last 3 years. Only 6% every year. And if we go to the next slide, I'm not terribly surprised. One more slide. We did a recent national poll through PAN's Center for Patient Research, and we found that only 1 in 4 people on Medicare had changed their prescription coverage and their plan over the last 3 years. So I think it's really important for all of us to take this time during open enrollment to consider our own needs and whether that a change is necessary. For the people in our poll who did change their plans, the key reason why they did so is because of rising premiums and deductibles. Next slide. So open enrollment, I think, and I think Susan would agree, is important every single year. It's important for all of us to engage in it every single year, but I would argue that this year is probably the most important year because the landscape is changing very, very quickly. We have heard that premiums may be increasing. We know that some plans exclude various drugs from their formulary or covered list of drugs. We also know, unfortunately, that in various communities across the country, fewer plans may be available. So your health and wallet are on the line. We encourage all of you to take time this open enrollment to review your plan options. Next slide. Now, Susan mentioned late enrollment penalty fees, and this is something that should be of concern. If you have just enrolled as part of an initial enrollment period in Medicare, you might have at that time enrolled in a Part D plan. Perhaps you have not because you have other what's called creditable drug coverage, perhaps drug coverage that's offered through your employer that is expected to pay on average at least as much as Medicare drug coverage. But there is a lifetime penalty. So if you have gone a little bit more than 2 months without Part D or other creditable coverage after becoming eligible, you'll pay a penalty, and that penalty lasts a lifetime. The only exceptions are if you qualify and are enrolled in the Extra Help federal program, or if you appeal. The penalty is defined as 1% of what's called the national base premium, which in 2026 will be $38.99 for each month you have delayed. So you can see that those costs can add up certainly over time, and that national base premium may change every year, year over year. So something to think about. Next slide. So let's get ready for open enrollment. And if we move to the next slide, here's the timeline. In September, you should have received your annual notice of change document from your Medicare Advantage plan. You should also, if you are in traditional Medicare, received your Medicare and You handbook. October 15th through December 7th is the open enrollment period when you can make various changes. And January 1st is when those changes will take effect if you're sticking with your existing plan, or if you enroll in a new plan when that coverage will begin. Next slide. At PAN, we like to define the open enrollment process as a 5-step process, and we'll go over each of these in detail. The first is to review that annual notice of change document from your plan. Second is to reflect on your personal health needs and budget. Third is to compare plan options using Medicare's Plan Finder. Fourth is to consider participating in the Medicare prescription payment plan. And then 5, seeking out resources to answer any questions you might have. So let's go through this process. Step 1 is reviewing your annual notice of change document. This document is important because it highlights all the changes, whether it be in coverage of services or costs or healthcare providers, from this year to next in 2026. And it may help you decide whether you want to stick with your current plan or consider changing it to a new plan in 2026. Next slide. Interestingly, when we polled people on Medicare several months ago about open enrollment and specifically asked about the annual notice of change document, only 2 in 5 people on Medicare told us that they actually take time to review this document. It's a long document. They have no interest in reading it. It's way too long. It's complicated. That may all be true, but even so, it is very important that you take time to review the document and make your own decision whether you think you want to explore another option, another plan option during the open enrollment period. Next slide. Step 2, think about your personal health needs and budget. We know it's very, very hard to predict your health needs in the future, but think about your health needs today and what you may need in 2026. What conditions, what diseases are you living with? What prescription medications will you need access to? What healthcare providers will you need access to? Do you anticipate needing any procedures or surgeries? And will prior authorization for medications or those procedures or surgeries be required? So think about your health as holistically and broadly as possible. Secondly, think about your budget. What can you afford when it comes to paying deductibles, premiums, and out-of-pocket costs. As we know, they all add up and can be a significant part of your overall budget. Next slide. Step 3 is to compare plans with Medicare's Plan Finder, which is a free tool, and it is a terrific tool that helps you compare Medicare Advantage and standalone prescription drug plans in your area. You'll be able to compare these plans side by side in terms of the services and drugs that they cover and what they cost, premiums, deductibles, and copays or co-insurance. So I'm going to walk you through the next slide some of the screens that you'll see when you visit Medicare.gov. But first and foremost, please know that there are some portal changes for Plan Finder, and you'll be advised to set up a separate account on Medicare.gov, and to do so, you will need to provide a separate email address. In addition, and what's new, is a multi-factor authentication process, which is really just a two-step verification process, which is very important from a security perspective. It will prevent, people, unauthorized individuals from accessing your account. So this is an important few steps to take before you head into evaluating plans on the Plan Finder tool. Now, when you go to Medicare.gov, you're going to click on Find Health and Drug Plans, and it's going to take you to this page, Explore Your Medicare Coverage Options. You'll enter your zip code, and then you'll indicate what kind of plan you're seeking. Are you seeking a Medicare Advantage plan? Are you seeking a Medicare drug plan or standalone Part D plan? Or are you seeking a Medigap policy? You'll be asked whether you're getting help with your Medicare drug costs, for example, through Extra Help or the Low-Income Subsidy Program. And you'll be asked whether you want to see your drug costs when you compare plans. Likely the answer to that will be yes. Next slide. At that point, you will input all of your medications that you're currently taking. When you're completed, you'll hit Done Entering Drugs, and then you'll be asked for your address. You'll also be asked to select up to 5 pharmacies that may be near you, where you live, so that you can compare costs. Next slide. You'll be able to compare the plans and click on any plan in particular to dive into the detail in terms of what that plan costs in terms of premiums, deductibles, and your copays. And on the next slide, and this is where we begin step 4 about the Medicare prescription payment plan, but on this slide, you'll be able to see how those costs for the various medications that you're currently taking compare across the pharmacies that you have selected. Note that little box at the bottom here, which we'll come back to in a few slides, about the Medicare prescription payment plan. But before we dive into that, we have our second poll, I believe, about the Medicare prescription payment plan. And I'm curious from all of you, how familiar are you with the Medicare prescription payment plan? Are you very familiar, somewhat familiar, or I've never heard of the Medicare prescription payment plan? Let's take a moment to complete the poll, and then we'll see how you compare with our national poll at PAN. And just one more moment. Okay, let's see what all of you have said. I'm glad to see that a good percentage of you are very familiar or somewhat familiar. Only 35% of you have said you've never heard of it. And that makes me somewhat relieved because in our next slide, we show results from our recent national poll of Medicare beneficiaries. One more slide, please. Looks like we're stuck. Can we move to the next slide? Okay, we're having some tech issues. I know what that slide said, and it indicated that about 1 out of 2 Medicare beneficiaries were familiar with the Medicare prescription payment plan, but very few have opted into the payment plan to date.
Amy, I
And we're
think
just
we're having some technical difficulties, and I can quickly try and share my screen really quickly. It looks like that our colleagues, uh, let's see if I can
and I
share my screen
apologize
for
to
everyone.
all of you, but
Agreed.
technology issues happen.
Yes, they do, and we appreciate everyone's very kind patience here. Let me find where we were in all of this. Amy, can you tell me if you can see my screen?
I can see your screen. We're going to scroll
And we're going to go
down.
way further down than that. So let me find that for you
That's right where we
and
need to be.
let me make this much prettier for everyone to, nope, not now, please. Let me from the current slide. Let's see. There we go. How is that?
Perfect. Thank you so much, Amber.
Beautiful.
No problem.
Thank you for your help. So as I said, many more of you on this webinar today seem familiar with the Medicare prescription payment plan than those that we surveyed across the country. So that's good news. Across the country, only 6% of Medicare beneficiaries told us that they have opted into the Medicare prescription payment plan. So we're here to break the payment plan down into a little bit more detail for all of you because I think as step 4 of the open enrollment process, it is important for you to know about. Next slide. So the Medicare prescription payment plan is a voluntary Part D payment option. It went into effect at the beginning of this year on January 1st. And what it does is it doesn't lower your out-of-pocket costs for prescription medications, but it lets you spread those payments out over the calendar year, potentially making those costs a little bit more affordable for you. Now, to benefit from the Medicare prescription payment plan, you have to opt into this program through your Part D plan, either traditional or Medicare Advantage. Next slide. So, who benefits from the Medicare prescription payment plan? It is particularly helpful to individuals who historically have experienced very high out-of-pocket costs, perhaps more than the $2,000 in out-of-pocket drug costs this year. And that $2,000, as you may know, was the limit and all that you will pay out of pocket this year for your medication costs. Or perhaps you have a single prescription cost that is $600 or more. Perhaps you simply have trouble affording all of your medications at one time. So you see, for many, maybe not all of you, the Medicare prescription payment plan can be very helpful. But we do recommend that before opting into the payment plan, you think about whether you are eligible and can enroll in the Extra Help program or state pharmaceutical programs, or even assistance offered through charitable foundations like PAN. Because with the help from these programs, you may not need the Medicare prescription payment plan. Next slide. Now, the challenge with the Medicare prescription payment plan is that your costs may very well vary from one month to the next, and you're going to get a bill for those prescription costs directly from your Part D plan. You will no longer be paying for your medication costs at the pharmacy counter, which is a real change. Now, please note that the Medicare Part D cap goes up from $2,000 in 2025 to $2,100 in 2026. So when you opt into this payment plan, just know that by the end of the year, you will not have paid more than $2,100. Next slide. Every year you need to opt into the payment plan unless you are staying with your current plan and have already opted in. In that regard, it will roll over to the new year. Next slide. And just as a reminder, when we reviewed the Plan Finder slides, you saw at the bottom when we compared our medications and our pharmacies that there was a little box that referenced the Medicare prescription payment plan. If you click on that link that is included in that box, it will take you to a table that will show you from January through December what your estimated cost will be month to month. Next slide. And if you opt into the Medicare prescription payment plan, and then for whatever reason you decide you don't want to participate anymore, you can leave at any time. And when you do so, you'll return to paying for your medications at the pharmacy counter. You will need to pay any unpaid balance to your Part D plan. Next slide. So key takeaways. One, it is a terrific option if you want to spread out your costs. It is not for everyone, and we encourage everyone to explore other options first. You'll receive 2 bills from your Part D plan, one for your premium and one separately for your prescription medications. Opting into the plan is through your Part D plan. You'll be paying them directly. And again, no need to re-enroll in the plan in 2026 if you're staying with your current plan and have already opted in. Next slide. There are some very important resources as you think about open enrollment, think about the Medicare prescription payment plan. They are listed here, medicare.gov. The State Health Insurance Assistance Program is a terrific program because it provides free personalized health insurance counseling. We have at the Pan Foundation website a whole section devoted to Medicare and open enrollment. And we have a link here for the Extra Help program through the Social Security Administration. Next slide. Okay, Susan, back over to you.
Thank you, Amy. So now we're going to talk about open enrollment and the media. Medicare Advantage plans can begin advertising on October 1st. So if you're watching television or going to your mailbox, you have probably noticed the flood of things that are arriving. So some of the tips that we like to share are please be cautious with the ads that you see on television or if you receive a postcard in the mail. They may only highlight the best parts of the plan, and sometimes they tout benefits that may not be available in your area. So it's very important to know that a lot of these ads that you see on television are nationwide ads that may be applicable to another state 5 over from yours. So it's very important to have that caveat in your mind when you're watching these ads. Please do not share any personal information with someone who calls you, texts you, or emails you unexpectedly saying that they are from Medicare. Medicare will never call you and ask for personal information. And please know that any high pressure tactics should be a warning sign to you. They're trying to create a false sense of urgency, so please be cautious of that. And before enrolling in anything, if you're not 100% sure, please reach out to those trusted resources that Amy just shared with you, such as medicare.gov or your state SHIP program, to confirm what you've heard. So the next slide, we talk about the Medicare Advantage marketing of what agents and brokers are. So agents help in comparing private Medicare plans to identify the best options. They do not sell Medicare Part A and Part B, and they work on commission based on the policies that are sold. So please be aware with agents, they may only show you the policies that they receive a commission on. So when you're working with them, ask them to show you everything that's available in your area. Agents may represent one or more insurance companies. Brokers actually work for you, the person looking for a Medicare plan, and they work as an intermediary between you and the insurance company. And once your Medicare plan is identified, the broker will turn you over to the individual plan to enroll. So on the next slide, we talk about some of the things that agents and brokers may do. So they can call you if you have given them advance permission. They must use a CMS, that's Centers for Medicare and Medicaid Services, approved third-party marketing organization disclaimer language in the first minute of the call. So they need to identify who they are. And all calls are recorded and stored, but we also recommend that you take notes on your call. And please note the time that you've called or they've called you and the individual who you're speaking to. Agents and brokers may leave information for you at a residence when a scheduled appointment results in a no-show. They may call you if you enrolled in a plan to discuss your plans and options. They may call or visit you anyone who attended a marketing or sales event if you gave prior permission. They may initiate a phone call to confirm an appointment that you've already had set up, and they may conduct a marketing and sales activity in common areas of healthcare settings, such as waiting rooms, cafeterias, and community recreational rooms. So on the next slide, we will talk about some of the things that agents and brokers cannot do. They cannot state that they are from Medicare or use words or symbols, including Medicare or its colors, in a misleading manner. They cannot market to or contact beneficiaries door to door. They cannot make unsolicited contact via text, phone, or in person with beneficiaries. They cannot conduct marketing or sales activities in healthcare settings except in those common areas that we just discussed. And they cannot provide meals at sales and marketing events. So another resource that we'd like to share with you is the Fraud Alert resource. It's our partners at the Senior Medicare Patrol. Every state has an SMP, and it's a national program that educates people on Medicare about Medicare fraud, errors, and abuse. They're a wonderful resource that you can call if you believe you have experienced healthcare fraud, errors, or abuse. There is a nationwide toll-free number down at the bottom of your screen, 877-808-2468, or you can visit the smpresource.org to find the SMP in your state. So some of the important aspects of Medicare coverage in 2026. Let's talk about it. So here are some changes that we are seeing for Medicare in 2026. As Amy mentioned, there is a cap, and it has gone up to $2,100 for Medicare Part D in 2026. Everyone benefits from the Part D cap. It is automatic. Those with high out-of-pocket costs for Part D will benefit the most. There is an automatic renewal of the Medicare payment prescription plan option. The Part A, B, and D deductibles may increase. We don't know those numbers yet. They were coming out very soon. There are two items from the Inflation Reduction Act of 2022 that are continuing. The first is the insulin cost sharing is not greater than $35 a month. And the Medicare drug price negotiation program will continue for high-cost medications. So to continue with some of the changes in Medicare for 2026, there is a zero cost sharing for adult vaccines, and that includes the shingles vaccine. CMS will start using AI in 6 states to test ways to provide an improved and expedited prior authorization process in original Medicare. It is called the WISER model, And those of you in the states of New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington state may be hearing more about this. Colorectal cancer screenings have also been expanded. Medicare continues to cover colon cancer screenings with a zero out-of-pocket cost. The minimum age has been reduced from 50 to 45 starting 2026. And for those of you going through a colonoscopy, if a polyp or tissue was found during this colonoscopy, prior to 2023, 20% Medicare copay was applied to your procedure. From 2023 to 2026, that coinsurance was reduced to 15%. From 2027 to 2029, that coinsurance will be 10%. And then starting in 2030, there will be no coinsurance owed if you have a polyp found during your colonoscopy. So there are some changes to the chronic illness benefits. If you are on a Medicare Advantage plan that offers chronic ill benefits, non-health perks, for example, a gift card, those are no longer allowed. The focus of the benefits will be on direct health, including meal delivery, rides to medical appointments, and in-home care support. So now that we covered some of the changes in Medicare for 2026, I'll hand it right back over to Amy for another poll.
Thank you so much, Susan. And before we head into some question and answers, our last poll, now that you've received information about open enrollment, do you plan on evaluating your options over the next few weeks?
Amy,
Yes?
I'm going to tell you, I'm not sure actually how to, with me now
Okay.
sharing, I'm not sure exactly. Let me see if I can figure out how to
That's
log.
okay. You know,
Okay.
I know we're running out of time, so all I will say here is that I would have hoped that the poll would show that the majority of you, if not all of you, have decided with this information to take time over the next few weeks, October 15th through December 7th, to evaluate your plan options.
Yes, exactly. And with that, Amy, I am going to stop sharing.
Okay?
And we are going to get into some questions because we have been able to, I really hope that we were able to answer so many of your questions that you guys sent in, but wow, the chat is just going crazy. And I've been sitting here scribbling down as many questions as I possibly can. And before we jump into that, I do want to start though, one thing that we were not able to talk specifically about that many of our PAN family we know is on. And we had a lot of questions about, Amy, are there anything that PAN grant recipients need to be aware of as it relates to how Medicare changes that Sue just mentioned? Is there anything that PAN grant recipients need to know in regards to these changes?
Yeah, no, thank you for asking that. And every single year, we take time at PAN to evaluate all of our assistance programs. We have over 80 different disease assistance programs where we can offer assistance. And we think about individuals' needs both in Part D, as in David, and Part B, as in boy. And we take into account, of course, the Medicare changes. So you'll see come January 1st, if you visit panfoundation.org, the new assistance levels for 2026.
Excellent. Thank you so much. And Susan, I'm going to do a little bit because I know we only have just a couple of minutes. I'm going to do some rapid fire questions
Sure
for you.
thing.
So here we go. Are you ready?
I'm ready.
Okay, great. There were a number of questions that came in through the chat that were looking specifically at, I'm turning 65 this year, but I'm not planning on needing Medicare until 67, perhaps. Will
Mhm.
there be a penalty if I don't sign up for Medicare at 65?
It depends. Now, if you or your spouse are still working when you turn 65, Medicare does work a little bit differently. So it's very important that you ask your employer, if you're still working, that provides your health insurance, if you need to sign up for Part A and B when you turn 65. They can provide you with a certification that you have creditable coverage, so you will not face a penalty when you do eventually enroll in Medicare Parts A and B. So it's very important to analyze your individual situation. It's a little bit different for everyone. That in general, we do recommend that people sign up for Medicare as soon as they're eligible. But if you are employed and getting your health coverage through your employer, it's important you have a conversation with them if you plan on working past the age of 65.
Perfect.
And there is more information on this on Medicare.gov. It's called Working Past 65 for more information.
Excellent. And we have another question that just came in. I have a regular Medicare Part D and prescription plan. No changes. Do I have to do anything?
Nope.
Regular Medicare and Part D and prescription plan. No changes. Do I need to do anything?
You don't need to do anything.
Okay, excellent. I have Medicare due to a disability. I'm not yet 65. Can I get Medigap?
No, unfortunately, you have to be 65 to be able to purchase a Medigap.
Excellent. Amy, quick question for you. I know we could not go into a lot of, is this particular drug covered under certain different medications? And that's why it's so important for all of you guys to go to your to Medicare.gov and do those and do the prescription search that Amy showed you earlier. But how about GLPs? Everybody's talking about GLPs. Are GLPs covered now with Medicare?
I wish I could say yes, but the answer is no. Medicare right now does not cover anti-obesity medications. There is a pretty big push in Congress to pass legislation that would enable Medicare to cover these medications, but we're not quite there yet. Great question.
Great question. And I'm going to ask Susan, you one more question. I have Medicare Advantage plan. Is the Medicare cost still taken out of my Social Security?
Yes, you have to still pay your Part B premium. And then if your Medicare Advantage plan also has a premium, you must also pay that as well.
Excellent. You guys, I wish we could, there are so many questions that continue to roll in, and we wish we could answer every single one of them, but we are also respectful of everyone's time today as well. We will do the very best that we can to get all of this information out to all of you, but I'm going to turn it back over to Amy really quickly as I share my screen again to pull up and talk through what the key takeaways are once again. So let me turn it back over to you, Amy, for our final key takeaways.
Thank you. And those were great questions. We could probably spend a full hour or more just answering questions, but
Might be a
here
good
are your
idea. Future
yeah.
idea.
Next time. Final key takeaways. Start early. October 15th is right around the corner, right? Don't wait until the first week of December to start the process to evaluate your options. Start as early as possible. Reflect on your needs as broadly as you can, both from a healthcare perspective as well as your budget. Review your current plan. Don't forget that annual notice of change document. Evaluate whether you could be eligible and apply for extra help or that low income subsidy program. As a reminder, in 2026, regardless of what plan you are enrolled in, you will not pay more than $2,100 out of pocket for your medications. Please consider the Medicare prescription payment plan. It is not right for everyone, but could be right for you. And then, as we have shared with you and will share following the webinar, use trusted resources to get additional information, whether that be from PAN, Medicare.gov, or your local SHIP office. And your next steps, as simple as start your process. Start this 5-step process to evaluate whether you want to change plans during the open enrollment period. Next slide. If you scan this QR code or visit the link at the bottom, panfoundation.org/open enrollment, it will take you to a wealth of information about Medicare and open enrollment. I encourage you to do that. As well, on the next slide, I encourage you to scan this QR code to subscribe to our email updates. That way you can, very easily on a regular basis learn about all of our programs here at PAN and see how you can engage with us on a regular basis. Certainly encourage that from a social media perspective. Next slide. Well, on behalf of Susan and I want to thank you all. In particular, thank you for your patience as we worked through our technology issues. Thankfully, it really didn't slow us down, so we were very grateful for that. But we're grateful for all of you spending the hour with us and sincerely hope this information was helpful to you and that you will start beginning tomorrow, or if not today, probably tomorrow, since it's October 15th, you can start your 5-step process to explore your plan options during the open enrollment period. Thank you again for joining us, and we will share our slides with all of you. Thank you.